Hi everyone, welcome to Center of Balance Live number 38 actually. I got two camera here, one is on Facebook, one is on YouTube. I'm waiting for Facebook to kick in. Okay. Doesn't seem to work on my Facebook. Let's wait for a minute. Starting live video. Okay. I'm going to start again. Hi everyone, welcome to Center of Balance live video. Today's number 38 video, live video. Now we're going to talk about shoulder impingement symptoms today. I'm sure that you guys have heard about that. So let's look at my notes. So shoulder impingement is a condition where your shoulders posture and rotator cuff tendons are intermittently trapped and compressed during shoulder movements. Okay, so shoulder impingement it can be very painful. It can be very painful. So persisting shoulder impingement it may cause shoulder bursitis and or are structurally injury to your rotator cuff tendons. So what is rotator cuff tendons? Is structure things in here. So the rotator cuff is including the muscle and tendons, okay, in your shoulder, and this part is the structure things. So this is now we need to understand about the structure first, right? Let's see. So if you hurt your shoulder, it may cause the rotator cuff tear or some compressed damage on the muscle. It commonly, when it damage, it results is a pain, right? So we need to talk about how do you know you have a shoulder impingement? So a common shoulder impingement symptoms including pain and clicking, okay, when putting your hand behind your head like this, okay, over your head, right? So and then when you do this, the pain presents. So this is one of the main symptoms that indicate that so shoulder impingement. Like normally if you get into the car and you try to put your seatbelt on, so you get your seatbelt and across your chest, and this movement, and you can't do it or it gives you pain, and that's another sign, okay, another conditions. Arch of shoulder pain approximately when your arm is at your shoulder height and all your arm is overhead. Same thing. Get it up, lift your hands up, so above your shoulder height, and you start to get pain. In some patients, they couldn't. It stopped. It actually stopped the movement. Move even further. That is another sign. Okay. Of course, pain when you're laying on your shoulder. If that is the pain, shoulder impingement on this side, and you lay on it and you get more pain. You may get pain when you at rest, which means a lot of people have that at nighttime when you're resting, you're not doing things, when you're silent, relaxing, and it get you more pain. Muscle weakness, okay, weakness is another one. Okay, you feel weak in your arm. So what is the best test for shoulder impingement? The real-time ultrasound with scan. Okay, so we mentioned about that in the past, in the last few video, ultrasound. Okay, so really, you want to diagnose shoulder impingement for the test, for the lab test. Uh, Ultrasound scan is a must thing that you need to do. Okay, because so ultrasound is cheap as well, and it's very effective. We mentioned about rotator cuff tendons and shoulder. Those are all soft tissues, and ultrasound scan are only be able to see soft tissue. So no X-ray, no MRI. Okay, X-ray, MRI, very expensive. Not to say that it only it X-ray doesn't tell bone, soft tissue problem. It doesn't help you to diagnose tendon and muscle. Okay, so yeah, really, ultrasound is something that you need to go if you have those symptoms that I just mentioned about. You suffer from that, and you should go and get an ultrasound. Talk to your physiotherapy, your doctor, your acupuncturist, and they will refer you to ultrasound. And as I think I mentioned about few times now, I have a patient who came in and hurt himself, had a fall, and the doctor said, "Well, that's nothing. It's just it's not a big deal, and just go home and take some painkiller." And because I look after this patient for many years, so he got an ACC claim. We're in New Zealand, right? It's an injury, so ACC will recover this kind of any kind of injury, right? When he came in, and we provide acupuncture, so we do acupuncture, and it was good, right? It was good. Needle there, and he felt better. He went home, and the pain quickly came back to how it was. Okay, and he couldn't move his arm overhead. So that is something that is, I think, okay, this is something not very clear. Even though when I put needle in and he felt better, there's no pain at the time, and he couldn't do that. I said, well, and the pain quickly come back after acupuncture, return, let's say, back to how it was. It's abnormal for acupuncture treatment. When acupuncture treatment works, it would accumulate. Then the pain, when it come back, it shouldn't be too bad, right? And I said, you should get an ultrasound scan. And then he went in and get it out. I refer, and he got a ultrasound scan. And actually, the tendons, the tear, it's quite a big tear, 9 times 6 mm. So I think, wow, this is not good. This is not good. You need to get in surgery for it. Okay. And at the time that he couldn't, because he has to work, which means he can do his work. It's just very painful at night time, and he can still perform his duty, and it was good. And we keep managing with acupuncture until the day that he got his surgery done. This is a keyhole surgery. Now it's very simple, and it's not a very aggressive one. Is pretty good, right? So he got his surgery done, and then keep coming back for acupuncture, and as well as seeing physiotherapies, and he's totally fine now. Okay, that was good. A combination treatment with keyhole surgery, acupuncture, and physiotherapies, and keep it going, keep it recover fully. This is part of the when we talk about shoulder impingement, because the tear and the tendon, it can present pretty much like a shoulder impingement. Okay, and that things that we need we need to rule it out, because some of them is just rotator cuff muscle and tendons issue. It actually doesn't have a tear, and those symptoms are pretty. In my clinical experience, they are pretty similar. So how could you tell? The only thing is go to ultrasound scan. So ultrasound scan is very important in here. Okay, now we talk about shoulder pain, right? And we talk about we really want to talk about treatment. So what can you do at home for yourself, right? In Chinese medicine, we know meridians. Okay, we know they have a tear in the muscle. We know you have impingement, shoulder impingement, or rotator cuff muscle issue or tendon issue. It doesn't matter what the diagnosis. Okay, the very true thing is you suffer from pain, and you want some relief, right? So this is we acupuncture kick in. Okay, acupuncture kick in will be able to help you release the pain. This is the first thing. Second thing, we want it to recover. Okay, we help it recover. How does it help? Acupuncture, it could stimulate your body and produce endorphin. So endorphin is 10 times more powerful than morphine. So it can reduce the pain. That's the first thing. Secondly, acupuncture move the blood circulation to your shoulder. Then when there's more blood to your shoulder, this muscle and tendons, they get more blood to nourish it and to get more nutrient, so it will be able to heal properly. So without blood circulation, nothing would happen. So when you get injured, those tight muscle in there, right, it actually prevent blood flow go to that injury area properly. That's why acupuncture is good. That is why massage is good too. But you need to be careful in there. If you just massage in here, you may get it worse, because if you don't know how to do it, right? If not an expert or any of your practitioners, if they do it on the wrong, they did a wrong technique and it make it worse. Okay, so in acupuncture we have a lot of different methods. We can use scalp acupuncture. We can use the opposite side called distal acupuncture. Okay, on the legs. Okay, and we can treat the organs, because we mentioned a lot about organs, because we know in this case it's all about tendons and muscle, right? So who control tendons, who control muscles? Spleen and stomach control muscle strength, and liver and gallbladder control tendons and joints. So spleen and stomach and liver and gallbladder function, they need to be good, all right? If they are not good, according to Chinese medicine, your shoulder impingement, it won't recover quick. Okay, it won't recover properly. So this is very important to get the organs better. So in Chinese medicine, we talk about constitution. What a constitution is, everyone has a different constitutions. Okay, and the symptom will be the same. Shoulder pain, everyone have the same shoulder pain. You know, everyone can apply on heat pack on it and feel better, or cold feel better, and everyone can have a massage in here and feel better, right? If you get some relief from it, and everyone can put some needles in here. But the thing is, constitution is different. Okay, if I suffer from shoulder pain and I have a loose bowel motion every day, I feel bloating every day, what does it mean? It means that my stomach and spleen are not balanced. My digestion problem is not good. That means that indicate that the muscle of my entire body is weak. I haven't got the strength. So if you're just treating the pain, treating the symptoms, you're not treating the organs, actual organs, bring the stomach and spleen better, and that symptom release, the pain release, it won't last. Okay, so we need to treat the stomach and spleen, bring the stomach and spleen function better. Then when you treat the pain, the symptoms, it will last. This is what we talk about. We treat the constitutions. Now, in this case, stomach and spleen weak with digestion problem, loose bowel motion, bloating, dry lips, and the energy side is get anxious, worry a lot. All these symptoms indicate that stomach and spleen are weak. Now, when we treat this shoulder impingement patient, we have strategy of acupuncture to treat the release the pain, which is treat the symptoms, cover the symptoms, as well as cover the constitutions. Now, if I have the shoulder impingement, I have a digestion problem, right? So my protocol is treating the symptom plus treating the constitution of the stomach and spleen problem. But if my friend B suffered from shoulder impingement as well, had the same symptoms, shoulder pain, as well as me, like similar, but he hasn't got stomach problem, digestion problem, bloating, stomach pain, all the symptoms. He actually suffer from angry, like very stressed, right? He may have like stress, angry, impatient, depression, eyes problem, okay, or other joint problem like tendon or shaky hand. All these things indicate, or bitter taste in the mouth. All this indicate that liver and gallbladder out of balance, which means in this B, my friend, we our diagnosis in Chinese medicine is to help him relieve the pain first. Secondly, we treat the liver and gallbladder rather than stomach and spleen, because he doesn't have any symptom of stomach and spleen. He has angry, stress, depression. They all indicate liver and gallbladder issues. So in this constitution case, we're treating liver and gallbladder. Therefore, when we relieve the pain, it will last. The result will last, and the result we will speed up the results. So, of course, if patient C come in, that he had suffered from shoulder impingement as well, but he had the constitution, maybe stomach and spleen and liver and gallbladder all out of balance, right? So in this case, we want to treat the symptom as well as the constitution of the liver, gallbladder, spleen, and stomach imbalance. So you see, this is how Chinese medicine do. We treat the constitution as well as the symptoms, right? We look at the full body. Patient A, we treat the shoulder, we treat the constitution of stomach and spleen out of balance. Patient B, we treat the shoulder, the symptoms, we treat the constitution of the liver and gallbladder out of balance. Patient C is a combine of A and B. So we treat the shoulder as well as treating the spleen and stomach and liver and gallbladder imbalance. So what I want to tell you today is shoulder impingement. It seems like in the Western side, in the physio, they have a set protocol for everyone, okay? But you will see that some people get better, some not. and they have to move forward for surgery. And even after surgery, they lose the mobility sometimes, the range of movement, right? And they're not healing properly. Why is that? So according to Chinese medicine, we have a say, we explain in this way, because when you treat the shoulder, you just treat the symptoms. You just look at the structure around the shoulder. But when Chinese medicine acupuncture, when we treat the shoulder, yes, we do the same. We treat the symptom first thing because we want to relieve the pain. But how do you get lasting results, and how do you get the result? Uh, uh, how do you get speed up the recover ability, the body ability to speed up the time, shorten the recover period. And this is important. We need to treat the constitution. We need to treat the organs in balance. So this is Chinese medicine. This is acupuncture. We have different thinking because we look at the organs. The organs control the entire body. We even check the emotional to find out which organs out of balance is causing the emotional. So this is very interesting. So this is how we treat patient and with chronic pain, chronic shoulder problem. We mentioned about shoulder pain. We treat 10 years of shoulder pain and been diagnosed for frozen shoulder and they couldn't move or whatever. We treat the organs, right? So I hope you liked this today's topic, shoulder impingement. We talk about how to diagnose, what is the symptom, and move forward to how what your doctor may tell you and how you treat it. And but in Chinese medicine, the acupuncture, how do we think about it and how do we treat it? Okay, so if you like my video, please subscribe to my YouTube channel and um, give me a thumbs up and share with your family in Facebook or YouTube. And I'll see you tomorrow. And you stay awesome. And I love you all. Bye bye.